And thanks for joining us for KSAT News at 9, streaming live right here in the KSAT 12 newsroom. I'm Steve Spriester. Coming up tonight, we're going to hear from a local doctor behind one of the Bexar County COVID-19 case projection models. We're also going to be joined by the mayor, who will be Skyping with us live to answer some of your coronavirus questions. And we'll explain how a local hospital is taking extra steps to make sure breast milk donors and the babies they are giving the milk to are safe. But first, there are now 1,126 confirmed COVID-19 cases in Bexar County. That's an increase of 46 from yesterday. About 31% of patients have recovered, a total of 350. 79 patients currently hospitalized with 22 on ventilators. For a third day in a row, no new deaths were reported. The death toll still stands at 39. Tonight, Metro Health now offering a word of warning when it comes to antibody tests. Those tests can be pricey, some costing as much as $150. And while there are 90 tests on the market, Metro Health Director Dr. Don Emmerich says only 4 are FDA approved. Those 4 that are approved are the following: Celix, ChemBio Diagnostic System, Ortho Clinical Diagnostics, Mount Sinai Laboratory. And while these tests are federally approved, Dr. Emmerich says there's another issue in all this.
None of the antibody tests, even the ones that are regulated right now by the FDA, none of those tests are reportable to Metro Health. So we have no idea what is happening, what test results are. We can't do any surveillance on them. There's nothing. It's not a reportable lab.
These antibody tests are not a form of diagnosis. Metro Health is relying on viral testing to diagnose patients with COVID-19. Those tests would only indicate if someone had the antibodies that would form after recovering from the illness. You've heard us talk about power plasma or plasma from COVID-19 patients who've recovered. Dr. Emmerich says only patients who are diagnosed through viral testing and have recovered can be cleared to donate their plasma at this time. Now, the treatment has also actually helped its second patient recover from COVID-19. Today, Mayor Ron Nirenberg announced a man named Joseph Doria was described to be fully recovered. He was just released from the hospital today. As the number of cases continues to rise in Bexar County, we're getting a better picture of what to expect in the future. 1 week ago tonight, the city began posting 4 different models on its website showing COVID-19 projections for Bexar County. RJ Marquez spoke with the UTSA professor responsible for one of those models.
When Dr. Juan Gutierrez was approached to do one of the 4 COVID-19 models for the city of San Antonio and Bexar County, he knew the challenge that was ahead for his team simply because of how far behind we initially were in tracking the virus.
It was the speed of this propagation that once authorities started locking down towns, then regions, they were always 1 week behind the disease.
Gutierrez, the chair of mathematics at UTSA, researched malaria for more than a decade, where he did multi-scale modeling for projections using math for the infectious disease. He studied asymptomatic carriers, meaning people that show no symptoms but still spread the disease, and saw a disturbing trend with COVID-19 early on.
Once this started spreading like wildfire with dry bushes, it was painfully evident to me and to others who work in the field that this could only be driven by asymptomatic carriers. This was spreading at an unprecedented speed.
Gutierrez started to build a COVID-19 model for Bexar County. His first report was released April 15th on the city's website. Since then, those models have slightly changed. He compares tracking the virus to tracking a hurricane.
So when you see a model, just pay attention to the date. It's like hurricanes. Those projections change every single day before the storm hits the ground.
Gutierrez said more test results has helped shape current models, but we will always naturally be behind the pathogen because identifying people that have been infected only takes place when there is community transmission.
Metro Health in San Antonio has been doing a good job given the constraints that we have. And essentially the main constraint is the lack of testing. This is a new disease. Tests take time.
His latest models show, with current restrictions in place, the active case estimates now vary from 1,800 to 3,800 through the end of August. Active cases means the number of people still infected, not those who have contracted COVID-19 and recovered or have died. The peak may have also shifted.
Given the fact that there is delay in reporting, and there is delay, a time lag between the moment of sample collection and the moment data is reported by Metro Health, it is quite possible that we have already peaked under current conditions in San Antonio.
One thing Gutierrez is sure of, had city and county leaders waited just days in implementing stay-home, work-safe orders, our current outlook would be much worse.
Had the mayor and judge in Bexar County not acted when they did, I run the simulations of what would have happened had the restrictions delayed one single week. And the number was thousands more cases. We're not going in a bad trajectory. San Antonio is moving in a very good trajectory.
For the 9, RJ Marcus.
To see all 4 projection models, you can just head to sanantonio.gov. And tomorrow on KSAT News at 9, we're going to be hearing more from Dr. Gutierrez about what he says could happen if we remove social distancing guidelines too soon. And reopening local businesses safely and effectively, certainly the goals of an economic transition team. This team was created by Mayor Ron Nirenberg and Bexar County Judge Nelson Wolf. It consists of leaders of businesses like Toyota and local web and app development company Sweb. The team has just under 2 weeks to come up with a plan. Today, we spoke to one team member about some ideas out there.
Protocols of sanitation, making sure that we're actually moving forward with those, and obviously limiting the number of people that can come together at once.
For a full list of which businesses are involved in the economic transition team, just visit KSAT.com. Let's take a look at the cases of COVID-19 in our surrounding counties tonight. Hays County now has more than 140 cases with 65 people recovered. Guadalupe County reporting 64 cases with 28 recoveries. Wilson County has 25 cases. Comal County has 47. A local hospital and the milk bank they work with are actually taking extra steps during the pandemic to make sure donors and the babies they are giving their milk to are safe. Mother's Milk Bank Austin tells us they are running through supplies quickly. Tiffany Huertas explains why these milk donations are crucial for the most vulnerable babies.
The breast milk, the donor milk that moms donate to these premature babies saves lives.
Anna Woods works at the NICU at North Central Baptist Hospital. She says breast milk has many health benefits, including fighting off infections. Woods says during the pandemic, they are still in need of donors.
I understand that sometimes moms are a little hesitant to come to the hospital environment.
The hospital is accepting milk donations through curbside.
We are seeing less people that are dropping off their milk. We're hoping that perhaps they're using some of the other sites.
North Central Baptist Hospital works with Mother's Milk Bank Austin. The nonprofit's executive director says while there is not a shortage at this time, they are quickly running through all supplies. Because of the pandemic, Kim Updegrove says there are challenges women who want to donate are dealing with.
The women who can't find childcare for their children so that they can go out to the labs and get their blood work done, a requirement to be a milk donor, aren't able to be milk donors.
Updegrove says women who want to donate typically have to fill out paperwork and get blood work done.
Mothers who are healthy and making more breast milk than their babies need can be screened. Their milk is donated and then the milk is processed or pasteurized to make it safe for medically fragile babies.
But the coronavirus has added a screening process for donors.
Are they experiencing a fever or shortness of breath or a dry cough?
Updegrove says they are following guidelines from the CDC and FDA.
The CDC says in limited studies that COVID-19 has not been detected in breast milk. However, they don't know whether mothers can spread the virus through breast milk. For the 9, Tiffany Huertas.
Let's take a look at the latest coronavirus numbers. In Texas, there are now 21,000 cases, 543 deaths. Nationally, 852,000 cases in the U.S., more than 47,000 deaths, and there are now 2.6 million cases globally and 183,000 deaths. Let's turn to tonight's 9 at 9. California artists celebrating Earth Day while social distancing. A species of snake named after a Harry Potter character. Plus a look at how COVID-19 is impacting communities across the globe. Here's tonight's 9 at 9. Spain will extend its state of emergency until at least May 9th, prolonging the country's stay-at-home order to 8 weeks in total because of coronavirus. The state of emergency first decreed on March 14th, which ordered severe restrictions on movement and business. Spain's prime minister says the return to normal will be slow, gradual, and secure. Meanwhile, a recent study shows the majority of nurses in Spain have been working without personal protective equipment during the outbreak. Of the 11,000 nurses surveyed across Spain, 74% of them said there were no masks in their work unit, and 55% reported a lack of protective gowns. Spain continues to have one of the largest numbers of healthcare workers who've been infected by the disease. Scientists in Italy say they may be able to find new clusters of the coronavirus by analyzing wastewater. The Italian Institute for Health says the genetic material of the virus has been discovered in wastewater in Rome and Milan. Researchers say tracking that material could be used as a warning sign to pinpoint potential new outbreaks. Officials say the coronavirus found in wastewater is not live, does not pose any additional risk for human health. Recovered South Korean COVID-19 patients are retesting positive for the virus, but they may not be contagious. South Korean officials say analysis of samples from patients who recovered from COVID-19 shows all had formed neutralizing antibodies to the virus, but almost half still showed active viral genetic material. However, the Korean Center for Disease Control's director announced at a press conference that these patients are likely no longer contagious. Wisconsin health officials say 19 coronavirus cases are connected to the state's controversial elections. The 19 people voted in person or worked the polls for the April 7th primary. A state health official notes several of the people who tested positive said they had other possible exposures to the virus as well. Target workers are planning a sick out for May 1st. The organizers say they don't have enough protection on the front lines of COVID-19. Target has reduced store hours and supplied masks to its workers, but they aren't required to wear them. In a statement, the company said it is important that Target team members feel comfortable sharing their concerns. Today, the 50th anniversary of Earth Day. Artists across Sacramento are decorating sidewalks with chalk to raise awareness on the climate crisis. 4 artists wearing face masks made a colorful display of Earth in the old Sacramento tunnel.
This is the 50th anniversary of this holiday, and we were planning to make it something huge all across the U.S. But when we no longer could gather and the stay-at-home orders were issued, we kind of had to readjust all of our plans.
A newly discovered snake species has been named after a character from the Harry Potter series. Scientists in India decided to call this green pit viper Trimeresurus salazar. The name is an ode to Salazar Slytherin, one of the founders of the Hogwarts School of Witchcraft. Slytherin is known, among other things, for his ability to talk to snakes. A 94-year-old World War II veteran being cared for at an assisted living facility in the United Kingdom gets a special surprise from one of his caregivers. The woman noticed the man took a photo of his late wife to bed with him each night, so she gave him a pillow with his wife's face printed on it.
Ah! Oh! Oh!
To read more about these stories, head to KSAT.com.
Hey everyone, and happy Earth Day. Yes, it's Earth Day, and it happens to be the 50th anniversary of Earth Day, which started back in 1970. So what exactly is Earth Day? Earth Day is a day in which we celebrate environmental protection in order to preserve the wonderful gift that is the Earth. And because it's the 50th anniversary, the whole world had these wonderful celebrations and activities planned for the 50th anniversary, but as you all know, COVID-19 happened and we're all inside our homes and staying off the roads and staying out of work. And so in a way, COVID-19, although it has been really damaging to the worldwide economy, it has protected the environment in a way. And I'll show you what I mean. At least there's signs of that. This is an image from NASA. And what it is showing is it's showing nitrogen dioxide in the air. And nitrogen dioxide is a precursor to pollution. It creates particulate matter when it interacts with the atmosphere, and particulate matter is pollution. So this image is the average nitrogen dioxide. Anywhere you see those dark purple colors, for the month of March from 2015 to 2019. This is the average right over kind of the New York City area and the northeastern portion of the United States. Well, as you know, just about everybody stayed at home for the month of March in 2020. Watch this. You can clearly see that the pollution is a lot less, at least recorded pollution is a lot less in March of 2020. Okay, let's go back. Here's a look at the average in March from 2015 to 2019. You can see concentrations around New York City, around Washington, D.C., and up toward Boston in Massachusetts. All right, here's another look. In 2020, when everybody was staying at home because of those stay-at-home orders, drastic decrease in nitrogen dioxide in the atmosphere. Now, climate is a very large thing that takes a lot of time to get good data because climate is a long-term thing. We don't really know exactly how the reduction in nitrogen dioxide in this month is going to impact the climate. We won't really know that for a long time, but the good folks at NASA are doing a huge amount of studies on this to see what the effect of not as many people out on the roads, not as much nitrogen dioxide is in the air. So again, although COVID-19 has done some pretty damaging things to our economy, it is interesting to see the effect that staying at home has had on the environment as a whole. Happy Earth Day.
Sarah Spivey will have a full look at your forecast a little bit later in this show. But coming up next, San Antonio Mayor Ron Nirenberg answers your questions about COVID-19. We're back in 1 minute. Fighting fear with facts. It's what we're attempting to do every night during this pandemic. At around this time tonight, we're joined by Mayor Ron Nirenberg, who of course gave one of his city briefings today, talked about the importance of masks, gave the latest numbers. And we're finding out just moments ago, actually, Mayor, we were talking about the fact that you're going to have a special meeting next Tuesday. Is that right? With
yes.
Both the county commissioners and the city council.
Yeah, so Tuesdays at 1 o'clock, the city council has been meeting to go over the working groups and the teams of city council members, community members, and court commissioners working on these urgent issues that the crisis has dropped on us. But on Tuesday next week, we will have a special meeting of the city council and the commissioners court together. We will primarily be hearing the public discussion of the health transition team's recommendations. So it's a big day with regard to where we are and the products of the work that we've been doing together as a community on social distancing and flattening the curve.
I don't know that there's ever been a joint meeting between the Commissioners Court and the City Council before, so that could be historic.
You know, I'm going to talk to the judge about that. We were just talking about should we do this today, and both agreed immediately it would be a great show of solidarity for the community. I got to ask him. He's probably the one that would remember such a thing, but I can't remember it ever being done. And you know, this whole effort to control this disease is about teamwork. This entire community coming together. So I think it's a great show for the council and the commissioners court to come together for a briefing.
All right, let's get to some of our viewer questions tonight. The first one, do you anticipate there being discrepancies with the city county's timeline to reopen the economy and the state's?
You know, it all depends. If the state mandates a timeline, then I do see conflict because, you know, we in the urban population centers of the city, of the cities, the major metropolitan areas of the state have been working together and have been on a different timeline. We had to issue social distancing measures before the state acted because we saw the threat looming with regard to the spread of this disease. And so I think our health transition team recommendations will give us a little bit more clarity on what timeline there is. But if there is a rush to open things up before the health recommendations say it's safe, then there will be a conflict. I'm hoping that the governor will continue to provide some latitude based on the health data that's happening locally, whether you're in, Bexar County or Travis County or Milam County. And I think that's going to be the marker of success as to whether or not the state can get through this as quickly as possible, because we don't want to be back here again. We want to do this once, have to shut down things, slow the spread of this disease one time. If we're forced back into more closures all over again, it will be all for naught.
Next question. Is it safe to drive in an open car, such as a convertible or Jeep, during the pandemic? Do I need a face covering while driving in an open vehicle?
Yeah, if you're driving alone, you don't need a face covering. And, if you're driving with other people in your car that are members of your household, you don't need a face covering. But if you're driving with people who aren't in your household, you should wear a face covering. And it's, a cloth face covering is best because we need that surgical grade PPE available for our healthcare workers. But the cloth face covering is primarily to protect other people from you, because the carriers of this disease quite often don't even have major symptoms. And that's how it's spreading to people who get very ill and ultimately many who die from it. And so the cloth face covering protects from, things that are expressed when you cough or sneeze, or even sometimes when you're speaking. And so, if you're carrying the virus and you have a cloth face covering, it helps slow down that spread. Obviously, if you're driving in a car, though, that's not likely to happen.
Yeah. Next question, I think you kind of just answered it, but we can maybe take it in a different direction. But why is it mandatory to wear a face covering in public when it does not protect my health, even when I know I don't have COVID-19? And I think you kind of just answered that. It's for everybody's health. But I know
and there's a lot of research. Yeah, there's a lot of research left to be done. But what is becoming clearer is that asymptomatic carriers are driving the spread of this disease. And so it's to protect other people from you. There is a little bit of protection, though, that comes with wearing even a cloth face covering. So don't dismiss that either.
And you talked in the briefing today about the fact that you're hearing businesses that are open where customers aren't wearing face masks, correct?
Yeah, and grocery store workers are part of the first response for this. They're essential workers because they're putting food on people's tables, and let's not make their lives more difficult by walking into a grocery store and without your face mask on. Again, you're potentially exposing others to risk who are customers, but also those grocery store workers who are, they have to be there. And so let's not make their lives more difficult. Just wear the mask, and stores won't have to, go through the extra effort of enforcing the face mask ordinance if you just keep it on.
Right. If you don't have any symptoms, can you still get tested? If tests show positive, but you don't have symptoms, do you have to get retested?
Yeah, so far, the guidance has been the presence of one or more of the COVID-19 signature symptoms. And the primary one is the presence of a fever, a high fever. The other is a cough, a dry cough. There are other symptoms, and if you call the hotline, you'll get screened. The question has always been about asymptomatic tests. When would you get one? If you've been exposed, if you're part of a vulnerable population that may have been exposed. For instance, we've had some asymptomatic tests done for people in nursing homes. But we don't, in the United States, have the number of tests, the volume of tests, and test equipment available to us anywhere in the United States to begin massive testing. It's one of the weaknesses of the United States preparedness for this pandemic. And so we all want to do asymptomatic tests. We want to do wide, community-wide screenings so that we can know exactly where this disease is and the infections are, but we just don't have that capability here in the country. We're fighting every single day and expanding testing capacity every single day. and doing so in a methodical way. But right now, nobody has in this country the ability to do wide-ranging asymptomatic tests.
Okay, my next question has to do with Fiesta. Why has November Fiesta not been canceled, given what the CDC is saying about the second wave of the virus?
Well, the CDC is saying that a second wave of the virus is likely if we don't contain the spread of this disease. If we let off the gas in terms of the containment strategies and the social distancing practices that we are exhibiting. So, there is a likelihood there will be a second wave, and people are pointing to the fall of the likely presence of a second wave. We don't know what therapeutics will be available. We don't know if there's, some vaccine that's developed. It's unlikely, but maybe there is. So, with all optimism and hope, we're going to party in Fiesta in November. But I will tell you, if the health guidance suggests that we are going to be in the middle of fighting this pandemic, a second wave of this in fall, we will cancel Fiesta. We don't want to have to do that, but I think it's a little bit too early to make that decision.
All right, I want to give you the final word tonight. What do you want our viewers to know?
So stay the course. What you have been doing is painful. We know people are frustrated. They're home and they're cooped up in their houses, and they really want to get out and enjoy the activities and go visit friends and, have a great meal at the restaurant that they used to go to. I'm right there with you. And, we will be able to enjoy those things again. We'll be able to cook out in our neighbor's backyard again very soon. But the ability to do that and enjoy life again depends on us staying the course. We have worked very hard to see this curve flatten. We have saved countless lives, thousands of lives already. And we are inching closer to the apex of this disease. Stay the course. We will get through this. And if we do our jobs correctly as a community, we will only have to do this once. This has been a painful process, but we are all in this together. We will get through this together, and we are going to be back stronger than ever.
Next week at this time, hopefully we'll be talking about what we see in our next Bear Facts poll. And we asked a lot of COVID-19 questions in there, kind of what the community is thinking and what they think, how patient they are with the stay home, work safe. So we'll talk about that next week.
Thanks a lot, Steve. Have a great week.
Thank you, Mayor. We'll be right back. On Capitol Hill today, the Senate unanimously approved a new $484 billion relief package. The bill aims to pump an additional $310 billion into the Paycheck Protection Program for small business owners. It will also include additional funding for hospitals and widespread testing, which experts say will be key to reopening the economy. The House is expected to pass the new relief bill tomorrow, with the president signing it into law shortly after. Here are today's top stories. HEB expanding its store hours. Starting Monday, April 27th, all stores will be open from 7 in the morning until 10 o'clock at night. That's a change from the 8 a.m. to 8 p.m. schedule they previously had in place to allow workers to restock shelves. Most pharmacies will continue to operate on the 8 to 8 schedule and their normal weekend hours. As of this week, face coverings are mandatory in public places in Bexar County. Because of this, San Antonio District 8 Councilman Manny Pelaez has created the Masked Hero Initiative. Photos of well-known people in masks are posted on social media for people to guess. And at the end of the day, it's revealed who's behind the mask. The goal is to raise awareness about the importance of the mandate. People are buying more booze online than ever before, according to Nielsen. Total alcohol sales for the week ending April 11th grew more than 26%. Online alcoholic beverage sales increased nearly 400% for that same week in April. That's just about a month after shelter-in-place orders began taking effect. Back here at home, a dozen members of a local family all tested positive for COVID-19 tonight. All have recovered. Great news. The 12 members of the Tejeda family live right next door to each other. They visit each other frequently. They say in mid-March, Robert Tejeda went to a party in Houston where he unknowingly contracted the virus. He then spread it to his parents, siblings, and their children. Robert, the last to recover, had the most serious case. He was in the hospital for a month.
He was in ICU. He was on the ventilator for 25 days.
Tonight, he is spending his first night at a rehabilitation facility and is virus-free. The family says the hardest part was that no one was able to be by his side. We're going to hear more from this family on the Night Beat at 10.